when it was about 51 murders in this city. The bishop said, we're going to do something about it. We're going to hit the street. And she said, come up here, Elder Langford, I'm putting you to work. Well, after that, we organized Healthy Oakland into a nonprofit. Her and I have co-founded Healthy Oakland, which is now Healthy Communities.
I feel Healthy Oakland is a very, very wonderful program for our community, especially here in East Oakland. We're working with, people that are endeavoring to better their lives, and so Healthy Oakland focuses in on your health mentally, physically, spiritually, and emotionally.
Well, thank you, Pastor Langford, first of all, for your leadership, your hard work, but of course, most importantly, for your prayers. Let me also thank Bishop Reams, and let me say how honored it is once again to be in your presence and to be with you as one of your dreams become true and become real. You know, it's very seldom we have a chance to witness the planting of a seed, a dream that's being discussed, and then see it come to fruition.
Certain populations in our county have disproportionately bad access to preventive and primary care resources. And the reentry population is among the greatest, has among the greatest unmet need for the traditional primary and preventative care services that are critical for any healthy existence in Alameda County. Our partnership with Healthy Communities and now Healthy Oakland is on many levels. It really began as a collaboration and focused on really on the social determinants of health, looking at those aspects of healthy decision making and environmental determinants that we could impact through education, advocacy, and outreach.
I'm so excited about Healthy Oakland because I remember when it was a figment of Reverend Raymond Langsford's imagination. He was working in San Francisco for the welfare department. I asked him, I said, Reverend Langford, you should quit your job because you're spending more time over here than you are in San Francisco. And he laughed, and he did. He pursued a dream. And I always say, if you could dream it, you can do it. And Reverend Langford dreamed it. And he found a storefront on San Pablo, and he opened up the center. And it's an incredible place. Part of my work takes me to San Quentin frequently. I'm on the Warden's Advisory Council over San Quentin, so I'm there a lot. And I have interactions with a lot of the men. And I know that if you, let's say that you've been locked down for 20 years, and imagine what Oakland looked like 20 years ago. And then you're given $200 and you're told to come out, you're free, now make it. It's impossible without an organization like Healthy Oakland.
And, my name's Sean Vasquez. I represent Healthy Oakland. And thank you for this board and this opportunity for me to get up here and speak today. I just want to speak on the behalf of the probation officer lady that was up here today and about the programs for everyone that's just getting out of prison. I just got out of federal prison 7 months ago. And when I was in prison, I didn't have no outlets about what I was going to do. First thing I thought about was selling drugs again. And, you know, I got out and I was in a federal halfway house, and, you know, I ran into a few people that was working for Healthy Oakland, and they gave me an opportunity to come up there and get a job. And gave me a place to stay. You know, I was one of the ones in the community that was caught up in gang activities, selling drugs, you know, committing a lot of crimes. You know, I never had an opportunity for someone to give me a chance. And Raymond Langford, Jasper Larry, was there to pick me up and lead me in the right directions. And I just want to ask the board if y'all have any power, if anything y'all can do, to help the community that's coming out of prison to come back into society, we really need help. Because it's a lot of us up in there that don't have no education. You know, it's a lot of us that gave up on ourselves. And we have kids. A lot of us don't know how to be parents to our kids. And if it's job opportunity, if it's programs out there to teach us and to lead us in the right directions, then we would have a second chance in life. I just come up here today to say, please, if y'all can do anything, please do it. Because we hurting out here. And I just want to thank y'all for giving me this opportunity.
The advantage of using a portal in disadvantaged communities is really that there's a place that people can go to, a doorway that they can enter in order to receive some of the services and care that they need. Oftentimes, people don't know where to turn in terms of getting, social support services or healthcare services. So the portal concept is really going through a door in order to see what other options are on the other side. It's a place where people can find some assistance in terms of knowing what direction to turn in order to get whatever social or healthcare support services that they need. So the portal within the community means that it's not across town. It's right there. It may be in their backyard or just a couple blocks up. So it's easier to get access to, easier to find a place to go ask the questions, and a place that has a lot of information and a lot of services that they very well may need or very well may not know that are available to them.
And I'll try to keep my comments brief given the issues of time here, is that how proud I am of Healthy Oakland and healthy communities and what Reverend Langford has accomplished. I also am a little bit apologetic that it took us so long to provide the little bit of support that we do for that organization, comparative to the need, and quite frankly, comparative to the kind of success we've seen in the short time that he's been in operation. And again, it testifies to the fact that when we try to build on existing resources and existing structures, how much more we can get out of them than trying to create new things, what don't really reflect the community, don't really reflect the kinds of support we can get by building on what it is. And again, what this is about isn't just treating people better, but it strengthens the very community for which they reside in and for which most of them come in. So you bring health not just to individuals, but to the communities themselves. I think I would like just to make 3 key points on this. And the first, there is never better a time for where the opportunity and necessity come together than now. The opportunity is in the Medicaid waiver. You're familiar with the concept. The state is doing all that it can to be comprehensive and inclusive in its planning process. But one of the key components of it is the expansion of the coverage initiative, which allows single adults to get some kind of federal participation dollars. That is so critical because that creates the funding level with the limited dollars that you're seeing in the local counties and throughout the state to be able to use what dollars they have and leverage it and bring in additional federal dollars and provide the kind of expanded clinical services that comes along with the faith-based organizations. The second part is the necessity issue. Regardless of how this reduction in the prison population plays out, there will be a reduction in the prison population. It's not sustainable. Even though I'm speaking on behalf of the county administrators and, quite frankly, a strong board that includes Supervisor Keith Carson and Supervisor Nate Miley that are 100% behind all of this issue here.
Yeah, I want to thank you all for this wonderful platform and a chance to speak on behalf of myself, Healthy Oakland, and the colleagues here of mine present. I just would like to say, first of all, my name is Alejandra, and hello again, and to just very simply give a human context to the discussions here today. We've heard a lot of numbers being thrown out, very real numbers, and necessary research that needs to be done to continue fantastic work such as that Healthy Oakland is doing. And with that said, I just want to point out that, as I said, in a human context, no longer am I a financial liability, if you will, or a liability to public safety and public welfare. I am now fully employed, full-time employee with Healthy Oakland. Because of Healthy Oakland, I have an opportunity to continue my higher education, and in those respects, again, continue to be a positive contribution to society rather than a detriment to society. And with that said, I want to thank you again for your time, and hopefully you'll take all of these suggestions and comments into consideration. Thank you.
I spent most of my years in the healthcare system, and I was around both starting at Napa State Hospital in 1970 when we started the major deinstitutionalization of the mental hospitals. And they made two mistakes when they moved to the deinstitutionalization movement. The movement itself was the right one to do, moving people out of institutions who didn't need to be there and keeping them in the community as well. The first mistake we made in those first decade of the 70s is that we didn't provide enough money, or as soon as we started to provide it, we started to pull it away. But most importantly, we didn't embrace an integrated model. We didn't look about how do you bring a person back, not just out of an institution, but back into a community and make them a part of that community. And so what you see here now is the necessity of the state, regardless of what political persuasion you are, to try to control the cost and growth of government by moving away from an institutional approach, but to do so in a way that brings them back into that community, uses the resources of the community, and better integrates them in there so that both the individuals and the communities are healthy as a result of it. It's possible, it's doable, and now's the time not to miss this opportunity and to integrate both in there. The second point is, again, I think we do have models. Not a lot of them, but again, Healthy Oakland, as you've seen in testimony to here, is the better way to go. Integrating the faith-based community with the clinical expertise of our community clinics and some of our private physicians in the community who have a long history of treatment to lower income Medi-Cal populations, that is the best partnership for a large part of this group because it allows us an integrated approach. We have learned over the years that they talk about warm handoffs and other kinds of approaches, but the more you create a connection with an individual and stay with that connection and do it in a wraparound way, the better the chances for success are. I have also seen many of the churches in the face in our community and how poorly we support and fund them, and yet how many they reach out to things. And a lot of that has to do with the problems of licensing and the problems requirements to it. But I'll tell you, if we can find a way to encourage and support the integrated models that build on the strength of our churches, build on the strengths of our clinics, we can make a difference. And then lastly, again, we have that capacity. We have the resources, we just don't fund them, we just don't support them. And that's because if you look, as the testimony is provided here today, in all of our key areas where we show those circles where high concentration, we have strong faith-based organizations. We have them there. We have less, but even more, but have some clinic expertise and skill, and they have a commitment of a healthcare system to willing to work with the population, but they can't do it alone, and they can't do it without the resources. If we find a way within whatever budget constraints you're in, to simply say is you don't get to do this alone, you've got to do it together, and you've got to include it in any opportunities they are, either to put money back in the community specific to this population or into health care. Do it together, do it in an integrated way, and do it in the areas where it's needed the most, and we will make a difference in an otherwise horrible year. Thank you.